Hello everyone, this is video case study presentation activity of endocrine disease from group 1. We will discuss this case in 4 parts. The first part is case study. The second part is innovation in care management of type 2 diabetes mellitus. The third part is transcultural nursing in part 2 type 2 diabetes mellitus. And the last part is the reference we used. The first part is case study. There's a male patient, Mr. Lee. He's 75 years old, 67 kilograms, 172 centimeters. He lives in rural China all year round, has low education level, and believes in Buddhism. His current disease is during autumn spontaneously weight loss of 3 kilograms every 3 months. In September the same year, polyuria, especially at night hours. After checking with GP, hypoglycemia 19.6 millimole per liter, so sent him to hospitalization in internal medicine. He suffers from hypertension and has had chronic surgery. He also has a family history of type 2 diabetes. Physical examination shows hyperglycemia is 19 millimole per liter. Glycated hemoglobin is 127 millimole per mole. Slight increased liver function test. Lipids and thyroid hormones normal. And the renal function shows microalbuminuria is 4 grams per liter. Blood pressure and eyes examinations are normal, but he has liver cirrhosis. A summary of the results shows that Mr. Lee has type 2 diabetes. His age, illness, and residence are not conducive to self-care. Cultural differences, such as language, is a major challenge in the care process. We think that the care management of Miss Lee can be reflected through innovation in care management and transcultural nursing.
Okay, it's my turn. My name is Cassie. For my part is part 2, Innovation in Care Management. In this part, I will talk two innovation. The first one is self-management education program. The second one is mobile phone technology. For the first one, self-management education program. Hawker said this self-management encompasses good lifestyle behavior that include ADA dietary choice, adequate physical activity, monitoring of own plasma glucose levels, adherence to medication regimen, smoking cessation, inspection of feet on a regular basis, managing sick days. Okay, we have all learned about this innovation before, which involves sending patients text message to interfere with their diet, exercise, blood sugar testing, and etc. For the second one is mobile phone technology. Blake said in recent years, there have been an increase in the development of health promotion programs which utilize the text message or voice response function of the mobile phone, either as an intervention per se or in combination with other technologies. These have been conducted mostly in Japan, the US, New Zealand, and more recently the UK, and have included interventions for diet or weight management, physical activity, alcohol and drug use, and smoking cessation, many of which has shown positive outcomes. New communications system has been used for the self-management of adult and children patients with diabetes who undergo rigorous procedure for blood glucose monitoring and regulation. Okay, for this innovation, the innovation is to interfere with diet, weight management, exercise, and so on by sending patients a phone call or text message. Besides, the system can sort out and summarize the patient feedback data and draw a chart to help the patients to be seen by the doctor when seeking medical treatment. This patient lives in the countryside all the year round, and the rural medical conditions are backward. He is far away from the big hospitals in the city, so he cannot seek medical treatment in time. Joining a diabetes self-management education program can help these patients manage his diabetes. Moreover, the patient's education level is also low, and it is easy for the patient to understand the disease through phone calls and text messages. And mobile phone technology can summarize the patient's feedback and draw a chart to help the patients to further seek medical treatment.
It's Yvonne. Let's move on to part 3, transcultural nursing. At this part, we will focus on age, religion, educational background, and language. First, age. The patient is 75 years old. Due to the age, his response to the nurses or doctors may be slow, and he is in high danger of falling, maybe cannot understand some explanations and precautions. Based on this, he may need family members to accompany. Based on these situations, nurses must be patient, wait patiently, communicate patiently when patients cannot respond in time. For the health education of elderly patients, nurses can choose to narrate orally, repeat, ask questions to see if the patient remembers, and use a form that is conducive to the understanding of the elderly. Elderly people do not have better mobility and flexibility. With the increase of age, the risk of patients falling is also increasing. The requiring family members to accompany is very important. During the nursing process, health education should be carried out for patients and their families to prevent the falling. At least one person is required to accompany when the patient is in the hospital. Second, religion. The patient's religion is Buddhism. According to Heart 2020, Buddhism encompasses a variety of beliefs, spiritual practices, and traditions, and the diet is usually vegetarian. Avoid alcohol, coffee, and tobacco. Medications are acceptable if they don't affect the state of mind. Avoid mind-altering drugs. For this patient, the transcultural nursing for religion is that we should focus on the diet and the psychological care. When preparing the patient's diet, be careful not to prepare meat and respect the patient's religion. Psychological care is very important, and we should also be careful when explaining the effects of drugs.
Language is also an aspect we should concern about. This patient lives in rural China all year around, which means he probably does not speak Mandarin. When we take care of him, we probably do not understand each other. In China, everyone can understand Mandarin, but not everyone can speak it. When giving care to the patient, if the nurse does not understand what the patient is saying, he can express himself by asking the patient to write it down or draw it down. Liu has said that the application of nonverbal nursing is an art of communication and an important way of communication between nurses and patients. The nurse can know the patient's condition timely and accurately and give messages. Last is education level. It has been mentioned before, this patient has low educational levels. So it will have some problems when we giving him health education. So as a nurse, when you're in charge of this patient,
When educating patients on health, explain to this patient carefully and patiently. For example, we're taking cough medicine after 3 meals. The patient needs to be told to take this yellow pill half an hour after eating breakfast, lunch, and dinner. John has said that for patients with low educational level, elderly or low-age patients, long-term multiple methods and repeated individual one-to-one demonstration education methods should be used for health education. That's all. Thanks for your watching.